A year ago, in March, Ghana recorded its first COVID-19 case, and our lives as we knew it ceased to be normal. We had to wear those masks, practice social distancing in public, emphasize on people washing their hands under running water, using sanitizers, and the rest. A year later, we have gotten vaccine for this COVID, but a lot of people are skeptical about using this vaccine. A lot of people have concerns. Today, I have with me in the studio a vaccinologist and global security health expert, Dr. Ken Osei-Kofi-Mensah, to join me do the discussion as we delve into the myths, the truths, with regards to the COVID-19 vaccine. Welcome, Doc.
Thank you very much.
You were a very hard man to find.
A lot of people would agree with you.
Okay, so to jump straight into the issues, Doc. Many people seem to think the vaccine is a drug for COVID. Is the vaccine a drug?
So, thank you very much for having me on today. Vaccines are not drugs. Drugs are mostly used for curative purposes in terms of healthcare. What vaccines do is they are more preventive. And that is, we find a way of introducing your body's own defense system into something similar to what the disease looks like, so that in the event that the actual disease is introduced into your body by infection, your body already has some practice run or some rehearsal in dealing with that particular disease. And that is what vaccines actually do. So they are not for treating COVID-19, they are actually to prevent you from getting COVID-19 in the first place.
Oh, okay. So we've heard that a lot of vaccines have been developed. What are some of the vaccines that have come out?
So vaccines have been with us for a very long time, since the 1950s. I mean, and the history for development of vaccines go way back into the Middle Ages. Vaccines have saved many, many lives. In fact, if you look at public health, with the exception of public provision of clean water and sanitation, vaccines have saved more life than any health intervention that has ever been introduced. But there are different types of vaccines. There are what we call the attenuated vaccines and other ones that are called the killed vaccines. But this particular one, technology has advanced in such a way that different companies or different manufacturers are using different forms of development in terms of the vaccines that have been introduced for COVID-19. Some are using RNA of the virus to develop the vaccine. Others are using some viral vector versions of the virus to be able to develop the vaccine. The most common ones that you find are being manufactured by Moderna and Pfizer are RNA vaccines. And the other one that is also being introduced into this country, the AstraZeneca vaccine, is a viral vector vaccine. And later on, we would also introduce the one that was manufactured in Russia, the Sputnik V vaccine, which is also a viral vector vaccine. And so different vaccines have different forms of development.
Okay, so the Pfizer and the Moderna vaccines have been reported to be 98% effective at preventing the COVID-19 disease. Why did Ghana opt for the AstraZeneca vaccine that is reported to be between 72 to 78% effective?
So, thank you for a very, very important question. I've had people say, oh, the vaccine is not actually very effective, but I think there is a bit of misconception there. It's true that the Moderna and the Pfizer vaccines are a bit more effective at preventing COVID-19 infection than the AstraZeneca vaccine. But the AstraZeneca vaccine is 72 to 75% at preventing coronavirus infection. But it is 100% at preventing infection that becomes so severe that you would need hospitalization. And that is the one we want to prevent, the one that people eventually end up in the hospital and are at the risk of actually dying. And so, in as much as the Moderna vaccine and then the Pfizer vaccines are 98% effective at preventing all forms of infection, the AstraZeneca vaccine is good at preventing you from going to need hospitalization if you ever get infected. Again, there is a matter of pricing. The AstraZeneca and the Moderna vaccine are extremely expensive, between $20 to $70 per shot. And for a low and middle income country like Ghana, and most of the other countries, even in the UK, they are using the AstraZeneca vaccine. It's relatively cheap, about $4 per shot. And again, aside from the cost of it, there's also other cost implications in the storing of the vaccine and the transportation. And we do not have that cold chain infrastructure in this country to be able to deal with the Moderna and the Pfizer vaccine. The Moderna vaccine needs to be stored at minus 20 degrees, and then the Pfizer minus 70 degrees. So imagine having to transport it. Today it's 42 degrees in Tamale. Having to transport it to Tamale. You need that cold chain system to be maintained, and that introduced extra cost in being able to handle those vaccines. And that was why it was imperative that we opted for the AstraZeneca vaccine.
Okay, so I think a few weeks ago, some people suspended the use of the AstraZeneca vaccine. What has been the development so far? Is it now safe for usage?
So some European countries, started in Norway, they decided that even though they've actually vaccinated millions of people with AstraZeneca vaccine, 33 people developed some form of abnormal clotting. And they suspected that
out of a million
people that had been vaccinated.
Okay.
And then they decided that this probably may be as a result of the vaccine. And so they decided to, as a precautionary measure, suspend the use of that vaccine in Norway and some other European countries. Later on, about 14 different countries suspended the use of the vaccine. But scientifically, there has not been any link or evidence to link the vaccine to the clots. Okay. And clots could come as a result of so many different things. And I think what they did there, it was not very prudent, because later on we'll talk about vaccine hesitance. People already are skeptical about taking this vaccine. And without any form of evidence, we are not saying the vaccine is not safe, it should be used, but without any form of evidence, just coincidental evidence of the fact that 33 people had clotting issues and had taken the vaccine, does not necessarily provide evidence to the fact that the vaccine caused the clotting. And you would realize that later on, the European Medicines Agency themselves came out to say the vaccine is safe. The WHO have said the vaccine is safe. And in Ghana, since we've been vaccinating people, vaccinated close to over almost 1 million people today, and we haven't actually encountered any episode of clotting with the people that have been vaccinated. So the vaccine is safe, is declared safe by the agencies that are responsible for it. And I think some of these knee-jerk reactions from some of these countries might have a detrimental effect on the advocacy that we need to do for other people to have confidence in the vaccine.
Okay, so there are recent reports of new variants of the virus. How effective is the vaccine against this new variant?
So that is the reason why we are advocating that if the vaccine services become available, people should avail themselves to be vaccinated. Okay. Here's the thing with viruses, and coronaviruses are no exception. They just want to survive. And in attempting to do so, they modify their structure to be able to survive. And so it's like a thief coming into your house in the night and wearing all black. That doesn't mean that's their choice of color, but they want to blend into the darkness because they don't want you to identify them. So they modify their structure, their genetic structure, such that the drugs that are being used to treat them will no longer be effective. And that only happens when the infection rate continues to rise, when they keep infecting people after people after people after people. The virus, as it stands now, the wild type, that is the original virus that originated from Wuhan, the vaccines are extremely effective against it. But research has also gone on to show that the vaccines that are being used has some level of efficacy against the new variants. The fear is that if we don't vaccinate people early enough, there will be new mutations that will result in new variants. And yesterday, there was a report from India that there was double mutated version of the virus, where the virus had both mutations that you would find either in Britain or you would find in South Africa on the same virus. And that is the danger. And so what you're doing today is critical to make people be aware that if the vaccine services become available, please do take the vaccine, because if the mutations continue to happen, there's a likelihood that we'll have a variant of the virus that no vaccine or no drug can be able to treat. And that is the danger that we are trying to prevent.
Okay, so I think there was a lot of back talk about Ghana being the first to actually get the COVID-19 vaccine. And can you explain to us why was Ghana chosen to be the first country to receive the vaccine? I
would share with you an interesting comment a friend of mine who interviewed me on a radio station said. He said, if you look at the rate of death from this coronavirus, white people are actually dying more than black people. So why are we in such a hurry as a country to get vaccinated? So here's the thing. The bottom line is this. COVAX initiative, initiated by CEPI and then Gavi, which are organizations that have been dealing with vaccinations for years, was because if we left it to countries or individual countries to procure these vaccines, The rich countries have actually procured almost 54% of all the vaccines that are going to be produced for the next 2 years. And the poor countries like Africa have been able to secure only 14% of it. And that means that the rich countries are going to get vaccinated, and then the poor countries are going to be left with the disease. And it's going to become an African problem, like it always becomes. And so this initiative was in such a way that this particular COVAX initiative will provide some amount of vaccines to at least be able to vaccinate maybe about 20% of the country's population for a lot of low middle income countries in Africa, sub-Saharan Africa, and also in Asia and Latin America. But why Ghana was chosen is because the WHO, COVAX, Gavi, and CEPI looked at countries' capacity to implement the vaccination program. And we do bastardize ourselves as a country a lot, but we have quite a robust health system. And that includes our ability to even deliver vaccines using the drone system. And that means that our implementation measures, our implementation tools are way more advanced compared to other countries that were on the COVAX program. And so Ghana was one of the countries that they believed that if they deliver the vaccines, we had the capacity, our health system had the capacity to implement the vaccination program. And that was one of the key things that they looked at. So it wasn't a ballot. It wasn't because they wanted to use Ghanaians as guinea pigs for this vaccine, but it was because we actually were one of the countries in sub-Saharan Africa that had a robust health system that can actually deliver the implementation of the vaccination.
Okay, so if you just joined us, this is the Young Voices Forum, and today we are discussing COVID-19 vaccines, the myths, the truths, and also whatever is it that people are saying about it. And we have in the studio Dr. Ken Osei-Mensah to help us with the discussion. So I've heard that in the Greater Accra, I know people have been have taken the vaccinations, and why is it that Northern region was not selected to be part of the first regions to receive the vaccine?
So in economics, when your demand it's way bigger than your supply, that's how economics come in the first place. Public health interventions are a balancing act. If you look at the epidemiology of our COVID-19 cases, majority of it, more than 80% of it, you find it either in Central Region, Greater Accra Region, or in Kumasi, what has now been termed as the Greater Kumasi area. And so that means that this virus has what we call a productive number. And that means the number of people that if one person has the infection can be able to infect. So if you have, for example, if you have about 1,000 people in Accra being infected, and you have, let's say, 40 people in Tamale being infected, if the reproductive number of this COVID virus is about 2, that means one person can infect 2 people. So if one person can infect 2 people, in a matter of weeks, you will have this 1,000 people infecting 2 people each. And then you have about 3,000 people being infected.
Yeah.
And then the 40 people here might actually infect just about maybe 80, 120 people. So what we are doing is, as public health experts, I think the advice is that we don't have enough vaccine to vaccinate everybody. So why don't we use the areas that can have the most effect or the most impact? And that is the places where the infection is extremely high. And that's the Greater Accra area, the Greater Kumasi area, and some parts of the Central region. But that does not mean that other regions are neglected. We are expected to receive more of the vaccines over the period. And as I'm talking to you, there are more doses of the vaccine that have been delivered into the country. And other regions, and I'm aware that as of today, some parts of the northern region have started their vaccination program. And like we said, it's not everybody that's been vaccinated at the moment. Some priority people are being vaccinated and really got. So as much as possible, we want to schedule our vaccination program to have the biggest impact that it could possibly have because of the supply limitations that we have with the number of doses that we have been able to procure.
Okay, so I think that before the vaccines came in, we talked about people with underlying health conditions be the first ones to get the vaccine. I don't think that is exactly what I saw happen in Accra and the other regions that got their vaccine. So I want to know who qualifies to take the vaccine at the initial stage of the rollout.
So at the initial stage of the rollout, we are trying very hard to be able to vaccinate all health workers. Because if the health workforce is not available, there's a likelihood that our health system could collapse. And not just people who have COVID-19 would not get treatment, but people with other conditions. Because all of the other diseases did not take a vacation. The malarias and the typhoids and all of the other conditions. And so healthcare workers are frontline workers that are the first people to be vaccinated. The people enforcing the mask mandate that was instituted by government, for instance, the police, the immigration people that are preventing people from crossing the border into our country. These are all frontline workers in terms of our fight or response against the COVID-19. So this public health crisis normally takes the shape of a multi-sectorial approach. And so there are people in the media who are educating and communicating who are required to be able to take the vaccine. But I understand people's concern that we saw people who were supposed to...
we saw some celebrities like taking the vaccine, and I'm like...
Exactly.
In some parts of the country, health workers have not been vaccinated, so why are these people getting the vaccine?
So there's a reason for it. And that is because vaccine hesitancy is a big problem. When I say vaccine hesitancy, I'm talking about the fact that people either refuse or delay to take vaccines or vaccine services when they are available. And so you realize even when the president took the vaccine, there were people who did not believe that it was the actual vaccine that the president took. So to be able to instill confidence in the fact that the vaccine works, some people who tend to have a very large following are also invited to take the vaccine, and they normally will do it in public. And in doing it in public, people believe, oh, okay, the vaccine is actually safe, and this person that I follow, that I believe, like a celebrity, like a musician, like a movie actress, they all have a role in reducing the hesitancy that people have against this vaccine. And so that might be the reason why a few of those people were invited to take the vaccine. It has its public health benefit. It's not because they are special, but it's because they have the capacity to promote and reduce the hesitancy that people have with taking this particular vaccine.
Okay, so let's say I had COVID and then recovered, and I'm fine, I'm healthy. Do I still need to take the vaccine?
Well, the guidelines at the moment says that people who have recovered from COVID-19 infection for the past 3 to 6 months are eligible to take the vaccine. But those people are not necessarily priority people. Why are we vaccinating them? Like you said, they are new variants. And the variant that they may have been infected with may not necessarily be the new variant they might get infected with. And so they are frontline workers. There's obvious, there's a need to be able to vaccinate them. And so, yes, people who have been infected with the COVID and have recovered for a period of time are eligible to be vaccinated.
Okay. So, if you just joined us, this is the Young Voices Forum, and we are discussing the COVID-19 vaccine. So if you have any question, comments, or suggestions, you can just leave them in the comment section, and then we'll see how best we can address it later. So now the big question, are the vaccines safe? I think this whole vaccine hesitancy is as a result of people not believing that it is safe. I mean, we've heard a lot of stories, people saying that, well, if you take the vaccine, you might be barren, you know. If you take the vaccine, you suffer from erectile dysfunction. I mean, there are lots of things people are saying. Is it safe?
So, vaccine development normally would take between 5 to 10 years. But the COVID-19 vaccine was done under an accelerated program that eventually brought the vaccine around within 18 months. Even the vaccines that took 10 years to develop, or even more, there's still a little bit of hesitancy with some people. There are people who have doubts about the safety of vaccines, and that is because over the years, there's been a lot of information, mostly erroneous information about vaccines. There's been issues where some people have written articles relating vaccines in children to autism that are found out not to be true. But that's the thing, we are in an information age now, and it's difficult to pull back some of this information that have already gone out there. And with the age of the internet and social media, it takes a lot of people, very easy for a lot of people to go out there and spread misinformation. I can tell you that vaccines are safe. And almost young generations, almost every single one of them, have taken one form of vaccine or the other. We have taken the polio vaccine, people have taken the rubella vaccine, the measles vaccine. Recently there was a yellow fever outbreak, people took the vaccine. Every single year when there is an outbreak of meningitis in the meningitis belt around the Boko, Bogana, Vongo, Paga areas, vaccines are given to people. But the thing with this particular pandemic is that it's so global, and the misinformation is so rampant that a lot of people are spreading messages that are not necessarily true. Some of it is attempting to control it, like on Facebook and on Twitter and on Instagram. But for instance, how do you control misinformation in people's WhatsApp? statuses. And most of these things are quite difficult for health professionals to deal with. But the coronavirus vaccine is safe. The vaccine has gone through rigorous testing, gone through all the phases of vaccine development, and it has come out that these vaccines are safe. I know people in Africa normally have a little bit more skepticism with regards to things that come from the West, like vaccines and drugs. But a lot more people are being vaccinated in Europe, in the United States or North America, than they are being vaccinated in Africa. More than 50 million people have been vaccinated in the United States, and if the vaccine was not safe, they would not introduce it to their population. And so I believe that, people have questions. They are legitimate questions that people have. It is incumbent on us as health professionals to be able to provide answers to it. But there's some outright bordered on conspiracy theories and misinformation. And those ones are the ones that is quite difficult to deal with.
Okay. So we saw a lot of people in their bid to help people take the vaccine. They took their vaccines on television. Some even took videos and posted them that, they've been vaccinated, so other people should get vaccinated. But then also, they reported side effects. Are these normal?
So, undesirable or side effects, I would know what you said, undesirable effects, are common with almost every single intervention in healthcare. For instance, I'll give you an example. A woman goes to give birth and goes through CS. The woman ends up coming home with a wound that takes time to heal. The woman did not go to the hospital for a wound. Went to the hospital to deliver. The wound is an undesirable effect, but it's unavoidable. People take drugs, like malaria drugs, and they get extremely weak. You are not taking the drug because you want to get weak. You are taking the drug because you want to be free from a malaria infection. But the weakness is an undesirable effect, but it's something that you can tolerate enough to be able to deal with the main problem, which is your malaria infection. So most drugs and vaccines have some undesirable effects. For instance, the injection you took, the pain that you got from the injection, it's an undesirable effect. You went there for a vaccine. Yeah. You didn't go there for pain. Yeah. And so this COVID-19 vaccine also have some undesirable effects. And some of them include, some people have a bit of headache, some people have a bit of a temperature, some people have a bit of cold and feverishness. There's some malaise. Some people have a bit of a severe form of the undesirable effect, which is for a few days they may have some. I've heard some people report some diarrhea. I've heard some people report severe weakness and fatigue, but it's for a short period of time, and after that they recover. Almost everybody that I know that reported some undesirable effect have recovered, and then they are ready to take the second dose of the vaccine. So undesirable effects are normal with most medical interventions. And so it is not that so far in Ghana we've not recorded anybody take the drug or the vaccine rather and suffered prolonged severe undesirable effects from it. And so that should tell you that the vaccine is safe. It does have a bit of undesirable effect, and it differs from person to person. And some of them I've listed, and I'll go through them again. Some people have a bit of headache for a period of time, maybe a day, 24 hours. Some people have some feverishness, some temperature. Some people have some fatigue, and some people have some diarrhea.
I met someone yesterday at our shop who said it made him eat a lot.
Well, so more and more of these undesirable effects are being reported on a daily basis, but some are extremely rare. Like the diarrhea, for instance, very rare in very few people. Less than 1% of the people they are going to take this particular AstraZeneca vaccine that is available in this country are going to have those undesirable effects. So if you weigh the risk and you weigh the benefits, you would realize that some way, somehow, having a bit of headache and being protected from having severe COVID-19 infection that could eventually kill you, it's not a difficult mathematics to do. And so people should expect that a few of them, some people do not experience any undesirable effects at all. Okay. And that depends on your own immune system and the response they have to the vaccine. So I know that some people have a few tough 24 hours when they take it, but eventually they are okay and then they get back to doing their normal things.
Okay, so I got a few questions here from people that say that what to expect when you take the COVID vaccine. So I am going to tell you, so it's up to you to tell me if it's true. Tell me and the audience if it's true or not. So someone is saying it causes infertility, especially among young people. How true is that?
So that is a complete falsehood. And let me say that this is not the first vaccine that has been accused of causing infertility, especially among Africans. People have the mentality that the West is interested in eradicating Africans. Honestly, they are not. I'll tell you a reason why.
You can't say that.
They are not. And I'll tell you a reason why.
Okay.
Africa is probably the fastest growing, it is the fastest growing continent in the entire world. And for white people who are extremely capitalist, a growing population means market. They are not interested in even you reducing your population, because let me take a commodity like mobile phones. We don't produce mobile phones in Africa. It's all produced from outside of this country. If they eradicate you, who do they sell the millions and millions of mobile phones to? Makes them a lot of money.
Okay.
Africa does manufacture a lot of stuff. And so, for instance, mobile phones might be extreme. Take tomato exportation from Italy to this country alone. It's $1 billion industry. And they would not in any way want to lose that market.
Okay.
And so people should be rest assured that the West is not interested in eradicating the African continent. And what they are trying to do is, previously, this thing about infertility was first attributed to the polio vaccine in Nigeria. And that caused polio outbreak in Nigeria because in certain states, people refused to take the vaccine because they thought that it would make their children infertile. And so these conspiracy theories and myths have been circulating, especially on the internet, for a long period of time. The COVID-19 vaccine do not make you important.
Okay. So another person says she's heard that taking the COVID-19 vaccine can increase your manhood.
Well,
take a minute.
Well, that might not have been an undesirable effect, but but that is also not true. And that is, I heard an audio where a man was advocating that if it does increase manhood, he would want 3 doses instead of 1. But unfortunately, it does not. and that is also as a result of the misinformation that is going on. I think somebody sat down and thought they could be hilarious. But that's the thing with the internet.
Another thing that has been circulating is people say that the vaccine contains pork. And we know that we live in a country where we have part of our population being Muslims, and Muslims do not eat pork. How true is this?
So those are genuine concerns that people have. It's not just Muslims who do not eat. Adventists and other religious groups do not. And this particular information, I wouldn't call it a misconception. It comes from the fact that some vaccines have been developed like that, but not the COVID-19 vaccine. COVID-19 vaccine does not contain pork, and so people should be assured that the development of this particular vaccine did not include pork in its development. Like I said, some of the concerns that have been raised are genuine, and like this particular one, people need to be made to understand that it is not the case, and that they can have confidence in taking this particular vaccine.
So people also say that there is a microchip in the vaccine to track people. I don't know to track them for what exactly, but I think this is a concern that has been going on. People say, well, there's a chip that's going to track me. How true is this?
And this is because they looked at people who have been involved in this vaccine from the beginning, and people have been warning us over the period of time that there's a likelihood of a global pandemic of this nature. And they associate that with somebody like Bill Gates, who is a computer engineer, who's probably one of the most remarkable people that this world has ever seen. But what people don't know is that he's been involved with global health advocacy and global health initiatives for years. And the Bill and Melinda Gates Foundation donates more money than practically any country to WHO aside from the United States. And so they've been involved with UNICEF, they've been involved with the International Vaccine Institute, they've been involved with CEPI and Gavi, providing vaccines, funding for vaccines across the world. They've been involved with what they created called Global Fund, that was responsible for the eradication of malaria, tuberculosis, and HIV for years now. And he has actually vowed to donate practically all his wealth in his lifetime before he leaves this earth. And so that is the association people get. But if the white people wanted to put a chip probably in something to track us, there are a lot more things that we are way more attracted to than just vaccines. We like a lot of their stuff. And so, I mean, we don't do sardines here. We all like sardines. They probably put it in corned beef, don't you think? But that's actually not the intention. And so people tend to associate some bit of information they've got. Oh, Bill Gates said that there was a likelihood of a pandemic. And a lot of public health experts knew that with the rate at which there's global warming and the rate at which there's climate change, pandemics happen consistently. This is not the first one. The Ebola outbreak, what we call the emerging infectious diseases, have been consistent over the past decades. Almost every decade there's one. There was Ebola, there was MERS in 2015, there was SARS in 2003. Infectious diseases moving across borders is becoming a thing, and that is because of the biodiversity that is being destroyed, with people living close enough to wildlife, and then viruses jumping from these wildlife into human beings and all of that. Anybody who knows anything about global health knows that it's predictable. And so, as much as possible, I want people to have the belief that nobody's trying to track you. The easiest form to track somebody is their mobile phone. People don't go in without their mobile phones these days, but nobody's interested in tracking you. And they are obviously not interested in tracking you through vaccines.
Okay, you put up a very good defense for white people. I should know, but that's a conversation for another day. So back to the vaccines. Before we wrap up, I want to know, when people get the vaccines, when people take the vaccines, do we stop wearing masks as soon as we take the vaccines? And how will the vaccines be administered?
So the AstraZeneca vaccine that we actually are implementing its vaccination program in this country right now, it's a 2-dose vaccine. And what it means is that you don't get fully protected when you take a single shot. And the Sputnik V that's going to come later on also is a 2-dose vaccine. And that means that they are given within 4 to 8 weeks interval. You take the first shot and then you take the second shot. Now, the efficacy of the vaccine is only achieved after you've taken both shots. And so if you are vaccinated today, it doesn't necessarily mean that you are protected from the virus because you've gotten the first shot or the first dose of the vaccine. Again, even when you are fully vaccinated, and that means you've taken the 2 doses, it takes a period of time for your immune system to develop the protection you need to be able to resist the infection should it come your way. And so we still need to be able to adhere to what we call the non-pharmaceutical interventions or guidelines that were instituted in the beginning of this pandemic. And that means people still need to observe the personal hygiene, wash your hands as often as you possibly can, use a hand sanitizer if it's available. People need to be able to social distance also as much as possible, and people need to continue to wear the mask. And that is very, very imperative. And that is even because even after you've gotten the first dose, you are still at risk of getting infected if you do not protect yourself. And so, as much as possible, we'll still continue to advocate that people adhere to the interventions that have been put in place. Not all of us are going to get vaccinated at exactly the same time. It will take a long period of time, somewhere into 2023, for almost everybody who wants to be vaccinated to have access to the vaccine. And that's because we don't have enough vaccines. The vaccines are still being produced. And Ghana, as a country, we are getting just about 20% of vaccines from the COVAX initiative, and that will vaccinate just about 12 million people. We are over 32 million people in this country. And that means the 80% of the people, government would need to source for those vaccines, either through bilateral relations with other countries or to be able to procure them from the manufacturing companies by government. So as much as possible, I would advocate that people still continue to wear their mask, people still continue to social distance when possible, and people still continue to use the hand sanitizers and the washing of hands because you protect yourself and you protect your loved ones as well. You may have the infection and may probably be asymptomatic, but maybe your grandmother or your grandfather or somebody else in your family with underlying condition is at risk of having a fatal result as a result of the COVID-19 infection. So please continue to adhere to the hand washing, the mask wearing, and the social distancing.
Okay, so continue adhering to the hand washing, the mask wearing, and the social distancing. People, you heard it all. Today we had a conversation on the COVID-19 vaccines, the myths, the misconceptions, and the truth. I am very sure that you've learned a lot, and I am also sure I'm sure that I have also learned something, and all of us have gotten to know which one is the truth and which one is the lie and which one is the misconception. So I want to say a very big thank you to anyone that joined us today, and also thank you very much, Dr. Kennedy, for coming today, and also a very big thank you to the camera crew. Without them, this wouldn't be possible. So yeah, until we come your way, same time next week. It's bye.